Now to the co-leader of the Social Democrats, Deputy Róisín Shortall, please.
Thanks, Karen Corley. Minister, there were further revelations about the dysfunction at the heart of the health service in the Business Post at the weekend. Department of Health officials described a horror of waste in the HSE, criticised recruitment targets as incredulous and expressed concern at their inability to hold the HSE to account. Concerns about budgets in the HSE went all the way to the top. You yourself, Minister, were said to have spoken directly to the Minister for Health, Stephen Donnelly, about the €514 million supplementary budget for 2020 and expressed doubt as to whether it was needed or indeed utilised as intended. When the Business Post sought confirmation on this from the department, they were told that those remarks were hearsay. So I'm pleased you're here in the chamber today and in a position to confirm whether you had that conversation or not, Minister. There's a lot of detail in what has been reported for the past 2 weeks, which raises serious concerns about monumental levels of waste, inefficiency and profligacy within the health service. But I want to focus on just one area, and that's cancer services, Minister. Recently, the Social Democrats introduced a motion calling for hospital charges for cancer patients to be waived and for hospitals to stop using debt collectors to pursue cancer patients for outstanding charges. The government didn't object to our motion, but crucially it hasn't acted, and it had the opportunity to. In advance of the government's publishing its measures to combat the cost of living crisis, the Department of Health submitted a proposal that would have seen those charges abolished for everyone. It said it would cost about €30 million. The cost for cancer patients would be only a fraction of that figure. The government opted not to do this. Instead, it made a conscious decision that cancer patients should continue to be charged for chemotherapy and radiotherapy. How do you think, Minister, it must feel to be a cancer patient and read what has been revealed in recent weeks about the hundreds of millions of euro going into a black hole in the health service, while debt collectors are hounding you to repay outstanding debts related to life-saving services? So my questions, Minister, are, first of all, did you raise concerns with Stephen Donnelly about the €515 million supplementary budget in 2020? Why is it, Minister, that there are hundreds of millions of euro in the HSE budget for fake recruitment targets, but you can't find the relatively meagre amount that would be required to spare cancer patients the financial burden of paying for their care? And finally, will you commit to abolishing hospital charges, if not for everyone immediately, at least for cancer patients?
Thank you, Deputy Shortall. Minister.
Thank you very much, Deputy Shortall, for your questions. First of all, to respond to the comments you made there and the questions in relation to the articles on the Business Post. Minister Donnelly and I have a good working relationship. Officials between the two departments are engaging on an ongoing basis. We have a health budget oversight group that meets regularly, involving officials from both departments, and as you would expect, we have bilateral ministerial meetings as well on occasion, sometimes on specific issues, and we would have had one last year, for example, in the middle of the year to review progress on the implementation of the budgetary measures for 2021. As you know, the accounts for the HSE in 2021 are currently being finalised. Minister Donnelly would have given an update to the Cabinet today, for example, that on a cash basis, the health vote was €469 million below profile, and they're now calculating the level of accruals that relate to 2021, and it is expected that there will be a deficit of perhaps up to €140 million for 2021. Those accounts are due to be finalised by the end of this month, and any question of a prior adjustment relating to 2020 will be dealt with in that context as well. There was, as you know, a supplementary estimate of just over €500 million in 2020. The HSE ended 2020 with cash reserves of over €800 million, and over €260 million was ultimately given back to the Exchequer in respect of 2020. So the question of any prior barrier adjustment will be dealt with in the coming weeks as part of the finalisation of the 2020 accounts, and the Controller and Auditor General, I know, has commented on that issue and has outlined what the process is in relation to that. In relation to the issue of cancer care, I think, and you know more about this than most, the central tenet of Sláinte Care is that cost would not be a barrier to accessing healthcare. And the government is absolutely committed to meeting that objective and that goal. We recognise that any form of cost that people face to access vital healthcare is a barrier and must be addressed. I think we have made significant progress. We, as you know, very recently announced the further reduction in the drugs payment scheme threshold for medicines from €100 to €80. That is an important reform. We have provided €300 million in respect of waiting list initiatives across this year as well. And so the government is certainly of the view when it comes to cancer, but also other acute conditions, that cost is never a barrier to accessing the services that people need in our acute hospital system, and we are committed to achieving that goal.
Thank you, Minister. Deputy Shortall.
Thanks. I'm puzzled by your last comment there, Minister, because too often cost is a barrier to people accessing care. And for cancer patients in particular, unless they have a medical card or have private health insurance, they're faced with a bill of up to €800 per year just to get life-saving treatment. Now, how can you defend that, Minister? It is utterly indefensible. And while, of course, Sláinte Care calls for the removal of all inpatient charges, we're in year 5 of the Sláinte Care plan, and there has been no progress made on that. So that's why we're asking you to at least give a commitment. The money involved here is minuscule in the context of a €21 billion budget. And we're asking you to at least honour the decision that you made a couple of weeks ago with the Social Democrats motion, where you didn't oppose it, so in effect you're saying that that motion was right. Will you honour that now and make provision for the removal or the waiving of inpatient charges for at least cancer patients for the life-saving treatment and care that they must access? Will you set out a clear timescale for that?
Thank you very much. Minister.
Yeah, thanks, Deputy. We are committed to tackling the issue of costs generally in relation to access to healthcare. So we will be extending the free GP care eligibility to children aged 6 and 7 across this year. We have, as I said, reduced the drugs payment scheme threshold. In recent times, we've had reductions in the monthly prescription costs that individuals and families face as well. And we've provided dedicated funding of €30 million to ensure access for patients to new innovative medicines. Minister Donnelly has been clear that he is absolutely committed to addressing any eligibility anomalies or barriers to ensure the health system cares for those who are in the greatest need first. And I do not believe, Deputy, that there are people out there who need access to our public healthcare system in relation to cancer care who are not getting it because they cannot afford it. That is not.
True, Minister.
That is not.
Listen to the
it is not
Society.
a barrier, Deputy. And
it is
I think as a practicing politician, I have never encountered a situation where our public health system refuses to care for a cancer patient because they can't pay a bill. I've never seen that, Deputy. And if you have any examples, please bring it to the attention of the Minister and the Government, because access to cancer care in our public health system is not dependent on paying.
Now, on behalf of the